Good morning. I'm Mike Berkley, the founder and director of the Berkley Center for Reproductive Wellness here in Midtown Manhattan. It's Saturday, June 12th at about 10 after 10 in the morning. Welcome. So today I want to talk a little bit about idiopathic infertility and traditional Chinese medicine. What does idiopathic infertility actually mean? It means infertility due to no known cause. So let's take an example. We have a 32-year-old couple, and the semen analysis was negative, meaning that there's no pathology found in the male partner. The woman's FSH is 7, her LH is 8, her TSH is 1.3, her estradiol is 45, she's of normal weight and height, and she's in perfect health. And this couple's been trying to conceive with timed intercourse for 2.5 years, and they've been unsuccessful at every attempt. So the intriguing and plaguing question is why? The female has had an ultrasound, she's had a fluid ultrasound, she's had a hysterosalpingogram to check her tubes. Everything is fine with the woman. So as you can imagine, this is really the most frustrating type of infertility case there is, because the reproductive endocrinologist doesn't know how to proceed. So of course, they'll resort to doing several inseminations, and if that doesn't work, then they'll resort to doing in vitro fertilization because they don't really know what else to do. But let's say that the intrauterine inseminations and the IVFs don't work. Why not? Let's even take the case a little further out and say they do pre-implantation genetic diagnosis on the embryos, and they're negative. The embryos are fine, and she's not conceiving. So then the doctor suggests donor egg. I mean, where does it end? So it's a very frustrating thing for the doctor, and even more so, of course, for the couple. So the interesting thing about traditional Chinese medicine is that there's no word that's analogous in the medical language, Chinese medicine, to idiopathy, or no known cause. So that means in traditional Chinese medicine, every single case is diagnosable. So even though this couple presents with total physiologic findings, in other words, there's nothing wrong with either one of them from the perspective of health in general, or reproductive health in particular, obviously there are some subclinical issues that are manifest that are disallowing either fertilization or implantation from taking place. So when this couple goes to a practitioner of traditional Chinese medicine, that practitioner will interview the patient, both of them, and take their pulses and look at their tongues, and from all this information gleaned through this intake, if you will, there's always something that can be found in any human being that indicates an imbalance. And so once that imbalance is found, it's then the job of the acupuncturist / herbalist to try to reinstate, if you will, the balance of that particular individual. What's fascinating is frequently after this is done, conception will occur, and ongoing pregnancy will be manifest, and the patient will give birth to a beautiful, normal, healthy child. Now, I don't want to misspeak and suggest that acupuncture and herbs can cure every case of infertility. That's totally not true, and that's not my message. But my message is that frequently, where traditional Western medicine stops, traditional Chinese medicine can often start and take cases that are intractable or impossible from the Western reproductive medicine perspective and often yield success. Another thing I want to say here clearly is that I'm not suggesting that there's anything deficient, inadequate, or anything at all wrong with traditional Western medicine. Remember, 3 million babies have been born because of the advent of in vitro fertilization. So I'm very pro traditional Western medicine. I'm simply saying that there is another way. And really, as I've stated in previous presentations, in my opinion, the best case scenario for the patient, based on what I'm saying, is an East meets West approach to reproductive wellness. That is to say, if you need to do an IUI or if you need to do an IVF, fine, do it. But I strongly urge you to consider including acupuncture and herbal medicine in your treatment protocol, because it somehow either potentiates what the reproductive endocrinologist is trying to do, it improves what they're trying to do, or else it actually does certain things that reproductive medicine can't do. So, when you have a patient that's gone through 3 IVFs and they've all failed, and then you treat this patient for 2 or 3 or 4 or 6 months with acupuncture and herbs, and they do another IVF or an IUI and it succeeds, one must deduce that perhaps the introduction of acupuncture and herbs might have helped transform the patient into a parent. So on that note, I'm going to wish you all a great weekend, and thank you so much again for watching. And stay tuned, because I'll be coming back with other interesting presentations. Thanks again. Bye-bye.